Hello friends, good evening. So today we will discuss the diabetes mellitus. This is a very important topic for internal medicine. We will discuss this from the Davidson's internal medicine. So in the first chapter, in the first topic episode, we will discuss about clinical findings of a patient of diabetes mellitus as per Davidson. So, if a patient comes with a diabetes mellitus, what are the features, what are the signs we will look for in a patient of diabetes mellitus? We first have to look at the hand. We have to check for the prayer sign. That is, the patient cannot closes the two palm together properly. So that is the prayer sign we can see in the picture. This is a prayer sign, and then we have to look the skin, the protective layer of the body. We have to look for any features of the infection like abscess, bulla. We have to look for the pigmentation like acanthosis nigricans. We have to look for skin abnormality like granuloma annulari. We have to look for depigmentation or pigmentation. Depigmentation may be presented as such a vitiligo, which is more common in case of type 1 diabetes mellitus. We must have to check for the blood pressure, any association of the hypertension or part of metabolic syndrome present or not. We must have to check the axilla for presence of acanthosis nigricans, which is common in insulin resistance, that is type 2 diabetes mellitus. We must have to check the neck for the carotid pulse, association of the cardiovascular disease, BRUI, and associated with other endocrine disease like thyroid enlargement present or not. We must have to look at the face for the presence of the fat in the inner eyelid, that is xanthelasma, any cranial nerve palsy or ptosis or movement disorder of the eye, that is the indicator of cranial nerve palsy 3, 4, 6, which occurs in case of various sorts of cerebrovascular accident, which may be a complication of diabetes mellitus. In the eye, we must have to check the visual acuity, power of the eye. We must have to check the lens for any cataract present or not, and must check the fundus for the retinopathy. So there are various different stages of retinopathy: background retinopathy, proliferative, pre-proliferative, and maculopathy. So exudative maculopathy, very dangerous condition. We must have to check the other side, like we must have to check the insulin injection site. Is there any lipohypertrophy, lipodystrophy? In the abdomen, we must have to check the hepatomegaly, association of fatty liver disease. In the limbs, for muscle wasting, sensory or motor neuropathy, loss of the tendon reflex, any hair loss, skin pigmentation, presence of necrobiosis, liquidic diabeticum. In the feet, we must have to check the any foot ulcer, neuropathic or venous or arterial ulcer, foot deformity like Charcot neuroarthropathy. We must have to check the weight. Is there any significant weight loss or any obesity? Associated infection like in the mouth, we have to check the mucosal candidiasis present or not. Patient may present with diabetic ketoacidosis. In that case, patient may present with abdominal pain, tenderness, such as vomiting, dehydration, and breathing problem. So that is this is a very acute complication, can result in death if not treated properly. And so this is all about in the picture. This is the picture in the Davidson. We can see from hand. This is the hand. We must have again repeating in the hand prayer sign. In the skin there are some bulla, pigmentation, vitiligo, granuloma annulari. Then in the hypertension, then axilla, that is the acanthosis nigricans. In the neck we must have to look for the carotid BRUI, thyroid enlargement. In the eye, that is cataract, and the fundus, cataract, visual acuity, and in the fundus for retinopathy, and in the beside eye we have to look for the any xanthelasma present or not. Then in the hand, we must have to check the insulin injection site. In the arm, beside the umbilica, and in the thigh. So injection site, is there any lipohypertrophy, and then we must have to go down to the feet. That we must have to check the neuropathy, muscle wasting, foot ulcer, and obviously we must have to check the weight and look for the infection, and must have to look for any acute complication like push mole, bleeding, abdominal pain, tenderness. So this is all about in the sign we have to look for when patient presents of diabetes mellitus presents to a doctor. So this is the box given in Davidson, that we have to must have the examination of the hand. In the examination of the hand, we must have to check the joint mobility. Painless stiffness may result in clearorthopathy. This is painless stiffness. So this is the inability to extend the metacarpophalangeal joint more than 180 degree. So the patient cannot extend the interphalangeal joints more than 180 degree. That is the prayer sign. Then dupuytren's contracture. This is the nodule or thickening of the skin in the palm. So there is contracture inside inner side. And carpal tunnel syndrome. There is pain radiation in the wrist and which radiates to the hand. And there are trigger finger, and there may be muscle wasting and sensory neuropathy. So this is all about in the hand, and in the eye we already mentioned, and we must have to check the circulation of the whole body. Circulation is very important because there may be associated with some vascular atherosclerosis. So atherosclerosis may result in poor circulation and some arterial disease, and may be associated with some cerebrovascular accident, or there may be some bruise in different parts of the body, and there is some neuropathy resulting in loss of muscle power, and there is muscle wasting, loss of reflex. Ultimately, this loss of sensation can result in poor vascular circulation, result in different sorts of ulcer, and can result in different sorts of long-term complication and mortality and morbidity. So this is all about the first episode of diabetes mellitus. Thank you. Thanks for listening.